Pleasant day to everybody. I am Josefina Andrea Ombao, taking up Master of Arts in Nursing, major in Maternal and Child. Today I'll be talking about early infancy vitamin D deficiency as one of my teaching requirements. I'll be discussing the role of vitamin D in infants' nutrition and health, presentation and analysis of the data observed and the situation of an infant facing vitamin D deficiency, and a glimpse of the overview of vitamin D deficiency situation in Saudi Arabia and their management. The objectives of my discussion is to determine serum vitamin D status of infants that are breastfeeding less than 6 months and their mothers, and the factors affecting their status, their association with infant sun exposure and maternal vitamin D status in an urban community, the consequences of vitamin D deficiency if left untreated. At the end of the lecture, the audience will understand the importance of vitamin D in inclusion to infants' dietary intake. We'll gain insight about vitamin D status of mother and infant and formulate suitable intervention. We'll gain knowledge about the consequences of the deficiency if left untreated and its management in a critical setting. So, what is vitamin D? Vitamin D has a significant role in calcium homeostasis and metabolism. Vitamin D supplements are given to treat or to prevent osteomalacia and rickets. Those conditions are characterized with softening of the bones, proximal muscle weaknesses, bone fragility, and risk of fractures. In the Philippines, being abundant in sun exposure, vitamin D deficiency is not considered a high-risk disease. Despite of this, it was found that vitamin D deficiency and vitamin D insufficiency were highly prevalent among Filipino breastfed infants. Breastfed infants are known to be vulnerable to vitamin D deficiency due to the low vitamin D levels in human breast milk and are dependent on maternal diet. As vitamin D deficiency percentage in infants of this age was not known in the Philippines, used report pattern in South Korea by Choi. The study shows that 87% of the infants had vitamin D levels below the sufficient range. If compared, it's almost similar to South Korea's 90.4%. Previous studies have shown that infants born to mothers with normal vitamin D will become deficient after 8 weeks without supplementation, while those born of vitamin D deficiency mothers will quickly reach to a state of deficiency. The high prevalence of vitamin D deficiency and vitamin D insufficiency among breastfed infants and their mothers were unexpected in a sun-abundant country such as our country, the Philippines. Expressed breast milk from a vitamin D sufficient mother has a content of 33 to 68 per IU per liter, which is only 20% of 200 IU per day. Recommended intake for 0 to 5 months old, as exclusive breastfeeding remains the standard of care for the first 6 months of life. Our local studies are limited and mostly focused on adult population. Vitamin D status of Filipino breastfed infants has not been explored. National recommendations for vitamin D supplementation are lacking, probably because supporting evidence are unavailable. I'll be presenting to you the data that was collected from November 2017 until February 2018, 3 months during the start of dry season in an urban community in Quezon City. They were exclusive breastfed infants less than 6 months old, full term, more than 37 weeks without any complications at birth. Mothers of all eligible infants were invited to a short nutritional education on breastfeeding and importance of vitamin D. Informed consent was procured. General physical examination was conducted by investigators. Demographics, vitamin D, and use of sunscreens by the mothers were gathered. Mothers were instructed to fill out weekly sun exposure questionnaires to determine exposure. They are also asked for 3-day food diary a week prior to serum vitamin D extraction to assess their average daily vitamin D intake. There are 131 infants and mothers who participated in the study, and among them, majority, which is 77%, has vitamin D deficiency. 19 of them, which is 14%, were classified having severe deficiency. Only 17 or 13% had normal vitamin D levels, while the remaining 13, which is 10%, were classified having vitamin D insufficiency. Maternal prevalence, however, of vitamin D deficiency is seen in 31 or 24%, with one mother being severely deficient. Almost half of the mothers had vitamin D insufficiency, which is 48%. Only 37 or 28% of the mothers had normal vitamin D levels. I'll be discussing the article that was co-written by our consultant in NICU in Saudi Arabia. This is the vitamin D status in Saudi Arabia and what are the effects of the severe hypocalcemic vitamin D deficiency in infants. Vitamin D deficiency remains a major public health problem in the Middle East, especially among infants who are exclusively breastfed and born to mothers with high-risk factors such as low vitamin D stores, dark skin, sedentary lifestyle, and have limited sun exposure. It's a case of an infant who is 2 months old with attacks of apnea and focal seizure due to low calcium levels. Workup after the first unexplained acute life-threatening event should include electrolytes, especially calcium. Once hypocalcemia is identified, further investigation should define vitamin D status for both mother and infant. Seizures due to hypocalcemic vitamin D deficiency in infancy have been documented in literature, but early occurrence in association with recurrent acute life-threatening events has been rarely reported. Hypocalcemic seizure is the most common vitamin D deficiency and should be treated with calcium in combination of vitamin D therapy and may require prolonged ICU stay for the infant. This complication can be prevented if both mother and infant receives proper supplementation. American Academy of Pediatrics and Canadian Pediatric Society revised the previous vitamin D daily intake from 200 to 400 IU per day beginning soon after birth, especially for infants with vitamin D deficiency mothers or infants not exposed to sunlight. The recommendation for the studies were to raise awareness on vitamin D deficiency, intensifying micronutrient supplementation, and providing education on its importance to the mother and infant needed for their overall health. Increase awareness and campaign for maternal and infant vitamin D supplementation and sun exposure. Vitamin D deficiency is almost always neglected in our studies, mainly because we are a sun-abundant country. But the complications for its severe hypocalcemic seizures resulting from vitamin D deficiency is dangerous for the life of the infant. Vitamin D deficiency is an interesting topic because this is almost always neglected in our studies, and the impact of the deficiency is hazardous to the health of the mother and the infant. In our practice in Saudi Arabia, this is vitamin D supplementation is implemented to prevent vitamin D deficiency or insufficiency to infants, because Saudi Arabia is an abundant country, but women are not exposed to sun because of their sedentary lifestyle and the black garment they are using because of their cultural practice, and we cannot blame them for it because they are forbidden to show off skin, they are forbidden to go outside, stay outside for a longer period. It's their culture to wear black garments, so the sun exposure for them is low. Micronutrient supplementation to the mother and to the infant is recommended in our practice in NICU to prevent vitamin D deficiency, because chances that some of the infants in NICU presents hypocalcemic seizures because of the lack of calcium and vitamin D stores in an infant's body. It is highly recommended that we have to raise awareness about this micronutrient supplementation in order to avoid vitamin D deficiency in mothers and infants because of the hazards that may pose to their health. I hope that you have learned something about our discussion regarding vitamin D and its importance. Till next time, thank you very much for your time listening, and have a blessed day, everybody. Thank you.